done a few of these in the past, but this one we're doing a little bit differently. So did everybody get a chance to print out the report that was, I think Jackie probably put it in the Dropbox? Okay, if you get a chance, go to the Dropbox and print out that report because it'll help you. You don't necessarily need it because I'm gonna have the report on some slides. Um, Donna, I believe that where she put it, it might actually be right there where um, the webinars are listed. She might have it actually right there. Okay, but if you don't find it, I'll find out where it's at for sure, and we can let you know. But like I said, the report will be on these slides here, and then once we finish up today, I'll put this into a file, a PDF file, and then it will be with the recorded webinar. So you can be able to print out this whole thing if you want to. Okay, so today's going to be a little bit different. Like I said, I have a report. The only thing missing from the report is the impression and the plan. But the rest of the report is there, and we're going to go through the report. And your job is to come up with the impression and the plan if you can. What do you think should be done? We'll be going through different parts of the report to help you come up with that. But it's going to require you to kind of use your critical thinking skills, which is why I say the one supplies that you need is your brain, and that's pretty much it. So what are some of the skills required for critical thinking? Well, you need logic, you need memory, you need your attention span, and you need your research skills. So let's go through each one of these and see what that means. So logic is your ability to identify clues and sort information, which means basically you're going through the report, you're looking at the physical exam, you're looking at the labs, you're looking at her past medical history, you're looking at her chief complaint, the reason why she's in the hospital, and then sorting that information into a logical conclusion. Memory is keeping track of the pieces. So what that means is you have to remember, like if the doctor says the patient is a 31-year-old female at the very beginning of the report, but then later down the report, maybe in the physical exam or maybe even in the impression or plan section, he says he will be seen again. Well, you have to remember from the very beginning of the report that this patient is a female and not a male, and be able to change that. It also has to do with maybe at the beginning of the report said the patient is here for a knot on his right arm. And then down again and somewhere in the report later on he says maybe his left arm. So you have to remember, oh, wait a minute, there's a discrepancy here. So it's keeping track of everything. Attention span. Your body is here, but where is the mind? Are you thinking about what you're cooking for supper that night, or maybe plans you have for the weekend, or you want to go shopping and what you're going to buy? So where is your mind? Is it on your work, or is it on stuff that's going on outside of your life? And research skills. There's no substitute for research. If you don't know what a word means, what should you do? You look it up. If you're not sure if the doctor is talking about labs and he says the calcium is, 5.6, is that high? Is it low? Is it normal? If you don't know, you look it up. There's no substitute for research. Andrea asks, how long do you spend in researching a word? Andrea, that's really is different for everybody. For me, it's no more than maybe 10, 15 minutes at the very most, if that. Usually what I do when I'm trying to research a word is I listen to it, see what it sounds like. I will either go to Google and put in what I think he's saying if I really have no idea, but I think it's this and this is how it should be spelled. I might go to Google and look it up and see, okay, what comes up, and then look at the various different, if, a couple of different words or one word. I always look in the website to see what does this word mean and how does it relate to the context of the report I'm in. You'll be surprised at the number of times that you'll look up a word, you think it's this, and you go and put something in Google and something comes up and you go, okay, that's the right word, to find out it means something totally different than whatever the report is about. A funny story, and when I was in teaching transcription in Barbados, one of my students, I don't remember what the word was, but she looked it up on Google. The website came up and she goes, oh, that's the right word. So she put it in the report. I was grading the report and I thought, I've never heard of this word. So I went and looked it up, and it had to do something with mules. Like I said, I don't remember what the exact word was, but it had to do with mules. And I thought, what, why did she use this word? So when I went and asked her, why did you put that word in there? And she said, well, when I looked it up on Google, the website came up. And I said, did you read the website to see what the word meant? And she said, no. So that's why I always say open that website and read what the definition of that word is so that you don't put something about mules in a report. Besides Google, what do I use? I'll use websites like WebMD, Cleveland Clinic, Mayo Clinic, Lab Test Online if I'm looking for certain lab tests, drugs.com, rx.com, but I always go to my resources, my Stedman's resources first, like my word books. If I'm looking for a medication, I might put it in Google so I can get the right spelling, but then I go to my Quick Look drug book to look it up and see, okay, what is the dosage of that medication? Does it match what the doctor said? What is it being used for? Does it match what the doctor said? That kind of thing. If I look something up on, say, in WebMD, which is one of my favorite websites, then I read about it, what is it used for? How does it spell? That kind of thing. But I also go look it up in Stedman's to be sure. I use Stedman's word books a lot. If I can hear one word, if it's like, say, a 2-word term and I can hear one word, I'll look up that one word to see if the other word is there too. So I use a lot of different resources. Here's some of the websites I use. I'll type them in here in the chat box. And I think the labtest.com. And then the other ones I use, and I usually just type them in, is Mayo Clinic and then Cleveland Clinic. And then here is my favorite grammar website. That one is a good website for grammar and punctuation. That's my favorite one for that. Another one that is good for grammar that I do like and I use occasionally is that one. And I usually just type those in the search box in Google, and then the website comes up. Andrea says, I find that Stedman's doesn't have some words that I find in Google. Am I doing something wrong? Not necessarily, Andrea. It all depends. If it's a medication, it won't be in Google. If it's maybe, it could be like a lab or, something else that for some reason Stedman's doesn't have it. Usually it will if it's a lab, but it might not always be there. So you might just be looking in the wrong book. That could be what's going on. Also, if you don't have it spelled exactly right, you won't find it in any of the resources, even whether it's Quick Look Drug Book, Stedman's Online, or any of the other ebooks. If you have to spell it exactly right for those. Jennifer says, Quick Look Drug Book I never use. I cannot figure out how to use it. Jennifer, with Quick Look Drug Book, again, you have to spell the medication exactly right. And then let's say you put in the medication prednisone. Um, you're going to get back several different pages that will have prednisone is mentioned in those pages. And then it's just a matter of going through each one of those pages and looking for the one that is specifically about prednisone. So it does take a little bit of time if you're using the ebook. That's why I prefer my books. They're a lot quicker. If I'm looking for prednisone, I can just go straight into prednisone on my Quick Look Drug Book and look for it. If it's a brand name drug, it will tell you see whatever the generic is, and then you have to go get the generic. But again, it's a lot quicker to me on the actual book than the ebook. Patricia, yeah, MediLexicon is a really good website too. That's a good one too. Thank you for mentioning that. Okay, so the case of the missing diagnosis in this report, Donna, the Blue Book of Grammar, they do have a paid site, but you can also there's also like free information if you type in um, I don't know. Usually when I'm looking, I just type in things I'm looking for in my search bar. Like if I'm looking for commas, I'll type commas in my search bar. And then one of the sites that usually come up is the Blue Book of Grammar. And then I just go to it, and whatever information is there, sometimes it's free if it's, but it's very basic in that case. And that's one of the reasons I prefer the Purdue Owl website for my grammar and punctuation stuff. Okay, so in this case, we have the report, but like I said, we don't have the diagnosis or the plan in this report, so we're going to figure that out. So what are the questions that you need to ask yourself? And this will work for everything. It's just not for figuring out an impression, because as you know, the doctors will dictate the impression, so you don't have to figure it out. But when you're trying to figure out a word, then what are the questions that you need to ask yourself? Maybe you don't need to ask every single one of these questions, but you can think about the questions that you do need to ask. So for our report, the questions we need to ask is who, which is the age and gender of the patient, the what, which is the chief complaints, or what is going on with the patient, why are they being seen by the doctor. The when is the history and the characteristics of the history, what's going on with the patient, what's happened in the past. The where is the physical exam, and then the why is the evidence, which is like the labs and maybe diagnostic tests, those kind of things. So here's the present history of present illness. And if you'll notice in this, now let me tell you right off the bat, don't pay attention to formatting. This report isn't formatted to account specific, so don't pay attention to that. I don't care about spelling, punctuation, none of that. We're not looking at any of that. We're just looking at the information in the report to figure out what the diagnosis for this patient might be. So in the history of present illness, the patient was admitted directly from home to the intensive care unit. The patient presented to the ER, brought in by emergency medical services after sustaining an acute, sudden onset of chest pain, which was retrosternal, radiating to both arms, mostly to the left arm, associated with shortness of breath and with mild diaphoresis. Upon beginning of the pain, the patient took 1 sublingual nitroglycerin and 1 aspirin. Now, one of the first things, if I was doing this report, I would be asking myself the meanings of some of these words. So the word like retrosternal, well, where is that? And if you know your prefixes, suffixes, and root words and the meanings of most of those, you can figure this word out. Anybody have an idea what retrosternal means? Right, Christina, back of the sternum. So retro means back or behind. The stern is sternum, and al means referring to. So referring to behind the sternum or back of the sternum. What about diaphoresis? What is that? Sweating, exactly. Um, Probably profuse sweating, sweating a lot. So if you're looking at this, they had an acute, which is sudden onset. It means it just started suddenly. Chest pain that was behind the sternum. It was radiating mostly to the left arm. She had shortness of breath and sweating. Now, she also took a nitroglycerin and an aspirin. Why? Okay, a heart attack. So do you think that probably she is having one now, or maybe she had one previously, right, Jennifer? Previous heart issues. Okay, so we're going to move on. Right, she could possibly be having another one because she's having heart chest pains and sweating. So maybe she's having another one. So she's going to take her nitroglycerin and her aspirin. When the emergency medical services arrived, the patient was still having the same amount of pain. She was given a second sublingual nitroglycerin, was brought to the hospital. On arrival to the hospital, the patient stated that still the pain was about the same. And then she was given another sublingual nitroglycerin in the emergency room. Pain did improve with this, but it didn't disappear completely until the nitroglycerin drip was started. So what does that mean, a nitroglycerin drip? Are they dripping it on her, maybe her chest? Maybe it's like a liquid? Right, an IV, exactly. Okay, so now she's saying the patient is pretty active and claims that she did not have any more chest pain since her previous heart attack. So here we're saying she had a previous heart attack. That's something to remember. She does admit having joint aches and pains, but no major problems with breathing, coughing, weight loss or gain, or sleeping disturbances. For her past medical history, the patient has a medical history positive for coronary artery disease. She had an MI in 1979. She had an angioplasty at that time. She also has a history of hyperlipidemia, osteoarthritis, and osteoporosis. And why do you think it's important to know that? The hyperlipidemia, the osteoarthritis, osteoporosis. Why do you think that's important to note in her past medical history? Or is it? Is it just something the doctor's letting another doctor know that she has this? Could have problem with meds, right? Doctors definitely need to know that. May make a difference on test results and medications, contraindications. But also hyperlipidemia could affect your heart. Right, your history of illnesses can impact what's going on with you. Maybe something else is causing the pain. Exactly. So it's important to know that, okay, this is what's going on with this patient. This is what her history is. And that way the doctor is looking at everything. If she came into the hospital and saying, oh, I'm having chest pain and I'm sweating a lot, and I had a previous heart attack, then, I mean, the logical conclusion is say, oh, well, she's having a heart attack or something going on with her heart now, when actually it could be something totally different. So her current medications are hydrochlorothiazide, sublingual nitroglycerin, Zantac, Adalat, Lopid, and Relafin. Exactly, Jennifer. Anxiety can cause those symptoms too. So it's important to know those kind of things. exactly, Catherine. That happened to me too. I had started having serious chest pain, and when I went to the doctor, I honestly thought I was having a heart attack. And when I went to the doctor, it was just a pulled chest muscle. That was it. I was coughing that day. I wasn't feeling well, and had pulled a chest muscle. So, I mean, something, even though it's chest pain, it may not have anything to do with the heart. That's that's things they need to know. So if you look at these medications, if you were typing this report, would you just type these medications and say it doesn't matter? This is what she's taken, but the reason she's taking them doesn't matter. Right. You need to know, I mean, you need to know what are these medications used for? So, I mean, it doesn't take very long to look up a medication. And, right, you always want to look them up and their dosages. So, and if you look them up, then eventually you'll get to where you know the reasons medications are used for, and you won't have to look them up anymore. You might look up new ones, but the ones you're familiar with, you won't have to look them up, and you'll know this is what they're being used for. She's taking Zantac for ulcers and GERD is one of the reasons, and Zantac is prescribed. Adalat is for angina and hypertension. Lopid is prescribed for hypertriglyceridemia, and the Relafin is for osteoarthritis and RA or rheumatoid arthritis. Nitroglycerin, of course, is for angina pectoris and CHF, and her hydrochlorothiazide is an antihypertensive. So if you know that, once you do it, look them up a few times, you won't have to look them up again. You'll just know what they're used for. No, it doesn't matter if it's they use the brand name or the generic name, either one, because sometimes doctors you'll find also doctors will dictate a brand name maybe in one part of the report, and then later on in the report he might use the generic name. And most accounts will tell you don't make the switch. If he dictates brand in one part and generic later on, that's how you transcribe it. So it really doesn't matter which name they're using because they're used for the same thing. Okay, the patient is allergic to morphine sulfate and penicillin. So those are her allergies. If the doctor for some reason was to prescribe one of these for something, then you would definitely want to flag that report because if she's allergic to it, she shouldn't be getting it, and he might have made a mistake. She's a smoker of approximately 10 cigarettes a day. What does that matter? If she smokes, doesn't smoke, drinks, doesn't drink, why does that matter based on this report? Yeah, smoking could be affecting her situation. What's going on? So that would be important to know. Yes, contributes to heart issues. Um, could be contributing to her other diseases that she has. The osteoarthritis could be contributing to that too. So they did some labs. They did a set of cardiac enzymes. Exactly, Jennifer, can contribute to the flow of her blood in her veins. So they did her cardiac enzymes, which were negative for ischemia or necrosis. A troponin level was zero point 0.3. The first electrocardiogram showed normal sinus rhythm, had a left axis deviation, and a probable old septal scar. Uh, very poor R-wave progression in anterior leads from V1 through V5, and there was ST segment depression, mostly in the lateral leads. So, and we're going to get into a little bit of the laboratory data here in just a minute, kind of explain this in a little bit more detail. and talk about why they do cardiac enzymes, what's normal for cardiac enzymes, and talk about the different electrocardiograms and the types of reports that are the types of tests that they run with cardiac enzymes. So keep this one in mind, about the cardiac enzymes and the electrocardiogram. Her physical exam, temperature 97.8, pulse rate's 94, respiration's 20, blood pressure 163/75. Are all that's do those all sound pretty normal? Does any sound high to you, low to you? Patricia says it's a little high if at rest. The pulse rate, Patricia? Blood pressure is high. Okay. So yeah, pulse rate might be a little high. Respirations are probably okay, I think, but pulse rate might be a little bit high. Her blood pressure is high, 163/75. So, but if you remember her medications, she was taking Adalat for her hypertension. So she does have hypertension and taking medications for that. So in general, she's alert and oriented and she's responsive. Her head is her HENT, her head is atraumatic. Pupils are equal reactive to light. Extraocular movements intact. Sclera is anecteric. Conjunctiva is pink. Oropharynx clear. So sounds like everything's pretty normal there. Her neck, supple, no jugular venous distension, no carotid bruits. Lungs cleared auscultation. That sounds pretty normal. Doesn't sound like anything major happening. Heart sounds are basically regular and rhythmic without friction, rub, or gallops. There's no murmurs. Her abdomen is essentially benign. Bowel sounds are present. It's non-tender. Skin warm and dry to touch. Extremities, pulses are 1 plus. No edema. Full range of motion. Neuropsychiatric, the patient is oriented times 3. Moderate anxiety, which understandable with what's going on. Her cranial nerves are grossly intact. Um, See, Donna, actually, you'll be learning about all of these throughout the course. Medical report formatting kind of starts you off. The body as a whole, we'll get into it a little bit more. But as you go through the course, you're going to be learning about everything. It's in each chapter. And again, this is where doing some research comes in. Sometimes if you get a report and, he tells you the blood pressure is this, then that's where you just kind of take the time to look it up and you think, is this high or is this low? Is her pulse high or low? Um, you know, what does the extremities pulses 1 plus mean? If you don't understand those things, those are just things that you take the time to look up. So what do y'all think about her exam so far? Does it sound pretty normal? Do you see anything that stands out that maybe should probably the doctor be looking at a little bit in more detail? And if there's anything in here you're wondering about, is that normal? As you read about this stuff, um, no jugular vein distension. What is that? What does the jugular vein being distended have to do with anything? Take some time to look those things up and read about them, and so you'll understand what do they mean, what do they have to do with anything. If it's distended, what could be going on? But the exam seems pretty normal. It seems, nothing really stands out. So again, you have the questions that you need to ask. You want to put your pieces together. You want to ask the questions that I gave you earlier, the who, what, when, where, and why. Review the evidence, which is everything in the report. You want to check out the facts, which is your research. What does these things mean? What does it have to do with anything? And then you form an opinion. So again, the questions. And we're going to go through with them. So in the who, the patient's age wasn't given. So we don't know how old she is. If she's young, is she old? We don't know. But we do know she's a female. That we do know. The what, which is the chief complaint, is the acute sudden onset of chest pain, that it's retrosternal, behind the sternum, that it radiates to both arms, mostly to the left arm, that it's associated with shortness of breath and mild diaphoresis, which is sweating or perspiration. The when is your past medical history. She has a past medical history of coronary artery disease. She had an MI in 1979. She has a history of hyperlipidemia, osteoarthritis, and osteoporosis, and she smokes approximately 10 cigarettes a day. The where is the physical exam, which was essentially normal. Nothing really stands out on that. And it's also the laboratory. So the lab is also about the where. So they said she had a troponin level of 0.3. Jennifer, you have a mild diaphoresis starting the surgical chapter. I understand. And probably a little anxiety too. So a normal troponin, and here's a typo for me, is a normal troponin I, and you have to remember with this PowerPoints, for some reason, I and 1 look the same. So this is a normal troponin I, which is 0 to 0.1. And then a normal troponin T is 0 to 0.2. So if her troponin level, and the doctor didn't specify if it's a troponin I or troponin T, he just said her troponin level was 0.3, which is higher than either the I or the T. So her troponin level was a little bit high. So how is this troponin level used? And so they're ordered for people who have chest pain to see if they're having a heart attack or some other kind of damage to their heart. Usually the laboratory will offer one test or the other. They won't perform both of them. And then they'll also sometimes order other cardiac markers such as a CKMB or a myoglobin. Troponins are the preferred test for if they suspect a heart attack. They're more specific for heart injury than the other test, which your CKMB and your myoglobin can also become positive if there's a skeletal muscle injury. The troponin test is used to help diagnose a heart attack, to detect and evaluate mild to severe heart injury, and to distinguish chest pain that may be due to other causes. So the troponin will help the doctor figure out, is the patient having a heart attack or is there just something else going on? The cardiac enzymes negative for ischemia or necrosis. So cardiac enzyme studies measure the levels of the enzyme creatine phosphokinase and the protein troponin, so the troponin I or troponin T in the blood. If you have low levels of these enzymes and proteins that are normally found in your blood, the enzymes and the proteins will leak out of the damaged heart muscles, and then the levels in the bloodstream rise. But when they did these tests, they were negative for ischemia or necrosis. So the enzyme studies are done to help determine if you're having a heart attack or maybe a threatened heart attack. They check for injury to the heart after bypass. They help to determine if a procedure or some kind of medicine to dissolve a blockage has successfully restored the blood flow. So they're used for a lot of different things, depending on why the patient is being seen. Now, an electrocardiogram, that's a test that checks for problems with the electrical activity of your heart, and it translates the heart electrical activity into line tracings on paper. And then there's spikes and dips in the line tracings that are called waves. And the doctor will read these spikes and dips and can look at that and see, is there something going on with the heart? Is she having a heart attack? Um, you know, what's not working? What do I need to look at? So it checks the heart's electrical activity. It looks for the cause of unexplained heart attack. And it finds the cause of symptoms of heart disease. So if she's having shortness of breath, dizziness, fainting, palpitations, then that's what it's looking for. I can also see if the walls of the heart chambers are too thick. See how well the medicines are working. If there's any mechanical devices like pacemakers, are they working? And it can also just check the health of the heart for other diseases like your high cholesterol, your cigarette smoking, if you have diabetes, or even a family history of heart disease. It can check for the heart to see how well the heart is, how healthy the heart is with all these other conditions going on. So again, you have your questions and your answers. Again, the age isn't given, but it's a female, the onset of chest pain, the coronary artery disease, the fact that she smokes, the past medical history. And then you have your physical exam and then again your labs. So you're looking at all of that. So based on all of that, what would you say the impression is? And remember, there are no wrong answers for this. Um, but so what would you say the doctor's going to be looking for? And go ahead and throw them out if you have an idea. We know it has something to do with the heart. Okay, Catherine says an MI. Nola says an MI. Jennifer says an MI. Christina. Okay, an anterior myocardial infarction. Okay. So you're all thinking that Jeanette says anxiety. That's a good suggestion too. A blockage in the heart. Okay, well, let's see what the impression is for this patient. So the patient has been admitted to the hospital with a diagnosis of acute chest pain. Rule out acute myocardial event. So yeah, that's what he's going to be looking for. Oh, did you lose me? Am I back? Okay, good. So what do you think the plan is for this patient? Based on all of this, what do you think they're going to do to rule out this myocardial event? Do some blood test, observe, okay. An EKG, troponin, an echocardiogram. Okay, so they're going to admit the patient and place them on telemetry monitoring. They're going to perform a full set of cardiac enzymes and serial EKGs, and maybe a cardiology evaluation down the line for further testing, and follow the patient very closely. So y'all did a great job on this. And that's all it takes with when you're thinking about reports, when you're doing a report, and even if it's just one word that you're struggling to figure out, you look at everything around it. The sentence that it's in, what is it, what are they talking about? The paragraph that it's in. Um, why is the patient being seen? Does this have to relate to why the patient's actually being seen? And all of